It's one thing to have hospitals in the state equipped with medical facilities, and another thing to have patients who can access these medical facilities, most of whom are rural dwellers. Well, the state government says its policies are in place to ensure all and sundry are catered for medically. While the state-of-the-art facilities exist, people may not be able to access them. Distance could be a factor, but in some cases, people may not even know about them until it's too late to get effective or life-saving treatment. The Free Rural Health Scheme, which especially targets pregnant mothers and young children, screens patients. It offers early detection benefits and basic treatment as well as preventive care. Health education also forms part of the scheme, as does reduced costs of dialysis, especially as it affects a high number of Nigerians.
I think generally what interests us most in the Ministry of Health is because before now, I've always lived in this state, so I know what has existed in this state before now. Before now, it is almost impossible, even with all these hospitals around, although we have completed some, built new ones, furnished some, others. Yes, it is possible for you to have this hospital without people attending because of poverty. That is what His Excellency the Governor, that barrier is what he has removed.
Was an initiative which we pushed here from Delswith. If you come to the emergency room almost every day, there are one or two relatively young people who are in end-stage renal failure. And the Governor, Dr. Emmanuel Odwanga, kindly agreed to subsidize treatment for dialysis because most people, when they find that they're in kidney failure, can start dialysis, but because of the cost of it, both the cost of the dialysis sessions and the cost of medication to sustain them, find that they cannot continue. And many of them die simply because they can't afford it. So the governor then offered to subsidize it. So they pay probably about a quarter of what it used to cost. I think it used to cost about 20,000 naira, 15,000 naira. And the cost of dialysis for Delta State indigents is 5,000 naira per session, in addition to additional drug treatments per month, because they require drug treatment to maintain their blood levels per month. So the subsidy covers all of this. And this subsidy started on the 1st of June.
With plans to carry out its first kidney transplant in November this year, the Delta State government plans to make the surgery affordable in the long run, so Nigerians don't have to travel abroad for treatment. The plan is to make Delta State the health destination of choice for Nigerians and non-Nigerians alike.
It's almost so now. The teaching hospital is attracting people from Lagos, people outside Nigeria, to actually come there, because a place where you're doing spine surgery, neurosurgery, hip replacement. It was the first teaching hospital to do a total hip replacement. And many other surgeries and many other things that are not done elsewhere in West Africa. So it's a hub. But the issue, the challenge is, well, we hope that this vision will continue after His Excellency leaves, because he himself is a medical doctor. He has a good vision for the state. You know, he's putting a lot of things in place to ensure that we can actually, Delta State, the hospital will be like a tourist ground, medical tourism, where people will come. Of course, when these operations are being performed, money will be taken.
The state launched its free maternal health care program in 2007. It covers antenatal care, delivery, laboratory tests, and treatment of complications arising from pregnancies.
Our antenatal uptake is about 4,000 old cases a month and about 1,500 new cases every month. So you have that number. And again, our delivery rate I mentioned is about 400 deliveries a month. Now, that means, of course, that a huge number of our antenatal patients, as you see, are not delivering here. That is not abnormal, so to speak. Why? Because the average delivery rate in Nigeria in the facilities is about 35%. From our own analysis, since the free maternal services began, our delivery rate has increased significantly to about 44% in the facility, which is far above the national average. You understand? But of course, We have 1,500 new antenatal cases, 400 deliveries. You see the gap. So it meant, of course, that we needed to expand services. So we made representation to government that our services needed, our facility needed to be upgraded. Graciously, His Excellency began this massive 100-bedded mother and child care complex that you have seen as you came into the facility. Now, that complex, of course, we make sure that our delivery rate will far exceed the 44%. In fact, we will approach our 100% because that is 100-bedded facility. That's against our smaller facility, which we had previously. I'm sure you also saw that. That was a smaller facility compared to this purpose-built hospital that you saw there.
Since the initiative started, state records show a significant drop in infant mortality, and plans are on track to reduce it further by 2015, in line with the Millennium Development Goals. There's also been an increase in hospital-based deliveries. Delta State Government has appointed a commission to pursue these goals in healthcare, education, water, sanitation, and agriculture.
As we have complemented the investment of the state in the health sector, especially in the provision of primary health care, which is the issue you mentioned earlier. So what we do from this directorate is to go to existing primary health care centers, PHCs, located in the very remote areas of the local government, and build maternity wards. We have so far built 50 maternity wards spread across 25 local government areas of the state. We have equipped 150 maternity wards located in existing primary healthcare centers with essential obstetrics care equipment, EOCs we call them. We also procure delivery packs, which we hand over to the Ministry of Health for distribution to these expectant mothers once they as far as they patronize the PHCs and are due for delivery.
Hospitals and primary healthcare centers are located within a 5-kilometer radius in every community. This means expectant mothers can use the clinics rather than rely on the services of traditional birth attendants. Lilian Wajei is a member of a Macha community. Her home is a walking distance from the hospital. This was of great advantage for her.
There's no stress. It was night when I came in. It was around 11 o'clock at night, 11 p.m. when I came in. The gate was locked. Then I knocked. When I knocked, they opened the door. The gate man was there. They opened the door. I came in. They went to knock the door, and the matron came in. When he came in, I walked down here. They checked me. It was 3 cm. So they checked me. I have to stay. So they induced me with drip, because I normally deliver with drip. So after that, I have my baby. Not just quite long. They really helped me. That I didn't even bring some of my things. The nurses, they gave me even clothes. The first clothes my baby put on, there was one that gave me. I put on, so before they discharged me.
Children get free access to medical care from birth till the age of 5. Official statistics show that malaria was the most common disease affecting children under 5, affecting almost 50% of them. To tackle this, the state handed out almost 600,000 insecticide nets.
Speaking for the free maternal health care, from the time of inception till now, we have seen over 280,000 patients, pregnant women. And what does it entail? The moment these patients are pregnant, from the time they come into the hospital, is free card for them, free antenatal care, free blood investigation, free ultrasound, and then they are looked at, collecting antenatal care drugs until the time of delivery. And at the time of delivery, whether they need to deliver through cesarean section or through normal delivery, is free of charge. Sometimes we actually give blood to emergency patient that requires emergency. That has been very successful. We have had, in all, we've seen about 280,000 patients in the past 5.5 years. In this, about 120,000 patients have delivered in the government hospitals. 20% of, about 10 to 12% of these patients are actually delivered through cesarean section. And it's been very, the patients are happy, mothers are happy, I'm sure husbands are also happy because it's a burden removed from them.
For the past 4 years, there have been no cases of polio recorded here. That's due to a successful vaccination campaign. Bringing healthcare to rural communities has been a key goal, but the vision goes beyond treatment. Health education is also important, promoting prevention rather than cure.
But a few weeks ago, we launched rollback malaria in the state. Her Excellency, Mrs. Nere Udwan, is the ambassador for rollback malaria program. A lot of nets were given out. I think that's still ongoing. We have also here from the MDG given out a lot of nets. Our nets also came in quite handy when we had the floods and we had people in the camps, 14 camps all over more than 14 camps over the states. As you know, over 14 local government areas were impacted on and 4 were submerged. So we have people in the camps, took that. I think the most important area now for the rollback malaria program is the education. The advocacy for it, that needs to be ongoing. There are drama pieces, visits to schools and school children, and it seems like more and more people are actually using their nets. But it needs to be ongoing, so that because a new good habit that needs to be formed as soon as people are clearer about the positive impacts of using the nets.
There's still room for growth and opportunities for investment in Delta State's health sector, especially in the training of medical personnel. But the state government believes it's put enough into positioning the health sector as a key driver of its vision of a Delta beyond oil. Investing in the health of its population will surely contribute to a productive future. In the governor's words, only healthy humans can constitute a developable capital. But that's the much you can take on this episode of the program. Do join us again next time as we explore other sectors positioned to drive the Delta State economy beyond oil.